Meanwhile, the news of a second coronavirus vaccine comes as COVID cases across the U.S. soar at an unprecedented rate. Johns Hopkins is reporting in the U.S. more than 16.7 million people have caught the virus, and more than 304,000 people have died from it. Meanwhile, hospitals across the nation are racing to vaccinate those most at risk of contracting the virus. CBS News national correspondent Errol Barnett is joining us now from Metro Health in Cleveland. Hi, Errol. So great to see you. Show us what is happening behind you, if you would, and tell us about the mood as staff finally get vaccinated.
Yeah, Tanya, the mood is enthusiastic. I'm in one of the vaccination areas. There are a few behind closed doors for those that don't want to be on camera. And we've watched this morning here at Metro Health as dozens of people have come through here to get their shots. And you see their tagline right behind me, "Hope is here." One of the first, or I should say, the first doctor to be vaccinated this morning, Dr. Williams, said she lost a patient to COVID last night and again this morning, just underscoring how serious the situation is here in Ohio, and they expect numbers to continue to climb as we move out of the holiday season. But there is something that is quite fascinating. Doctors have just described to me what they're calling a Hanukkah miracle. So they took delivery of the vaccine yesterday in those temperature-controlled boxes, and we have some footage showing you today as they thawed the vaccine, took that vaccine out and combined it with a saline solution. Well, in essence, they expected to be able to make 5 doses of vaccine per vial with what they've received. But pharmacists have placed into each vial a little extra of the COVID-19 vaccine just in case there are errors or mistakes. And what's turning out to be the case here at Metro Health is, as they do the math and do this by the book, they are able to make 6 doses of the COVID-19 vaccine per vial. And so for this hospital, what that means is, instead of only being able to vaccinate some 975 people this week with this initial batch, they will be able to vaccinate more than 1,100. The doctors are making phone calls with other hospitals here and around the country to verify this information. They're saying they're following by the book the emergency use authorization to do this, but it's quite remarkable. They're quite emotional even as they describe this to me, because we are in the celebration of Hanukkah right now, of course, when 1 day's worth of oil lasted much longer than that. So the mood here is quite elated. Behind me, let me show you what's happening. Everyone you see here has either received a vaccination and then waiting 15 minutes to see how bad the side effects are, pains and a temperature increase. And they are prioritizing here at Metro Health, because it's one of the safety net hospitals, the support staff. We're talking janitors, security officers, and the like, who have just as much exposure to COVID-19 patients. So a real sense of joy in what is a really dark period amid this pandemic, which has already claimed more than 300,000 lives. Tanya?
And what are you hearing there, Errol, about the Moderna vaccine and what approval of that vaccine would mean for them?
So doctors here are telling us that they do expect this Moderna vaccine to be approved here in the short term. And what that means is that instead of only being able to vaccinate over 1,000 people with this initial batch, they would be able to add on top of that a few thousand more here in the next few weeks, because you do have to have these 2 doses spaced at least 3 weeks apart. Another thing this hospital is doing, and based on folks that we've spoken to, is they're making sure that people of color have access to this vaccine and are taking the vaccine on camera to help those who are suspicious. There was one security officer who was quite proud of protecting the temperature-controlled box as it came in yesterday, who was getting the vaccine today. He said, "Look, my family's reluctant. They didn't want me to get it. But my father, who's 70 years old and is immunocompromised, a man he describes as his hero, was on the phone with him and he said, 'Son, if I could get that vaccine, I would. You should definitely get it.'" And so he'll be getting the vaccine here today as well. That's what makes this hospital, Metro Health, different as a safety net hospital. As soon as they get more vaccines in, they say they will prioritize people in the area who don't have insurance, those who are living without homes, those with Medicare and Medicaid as well. So the most vulnerable populations. And all of this right now is something so welcome in this part of the country, which is being so intensely hit by this pandemic.
Exciting developments. Errol Barnett, thank you so much.
You got it.